Welcome to Physiomobility's Total Knee Replacement Exercise Program for Week 1. For the warm-up section, please repeat each movement 5 times before proceeding to the exercise section. For the first movement, take a deep breath as you reach your arms up towards the ceiling. If you can't reach all the way overhead, reach as high as you can go. You want to reach while taking a deep breath and opening up the chest as much as you can. For this next movement, you want to squeeze your glutes as much as possible while pushing your heels down into the floor firmly. Squeeze, hold for a couple seconds, and then relax. For this next movement, gently lift the heels off the ground and push the ankles forward to get some movement and blood flow into the lower leg. For this next movement, we are repeating the same exercise in a standing position where we squeeze the glutes, press the heels firmly down into the floor, and relax. When you squeeze, you want to hold for a few seconds and then relax the glutes. For the last warm-up exercise, we're going to be lying down on our back, focusing on ankle pumps, pushing through the toes to point down towards the floor and flex back up towards the ceiling. Now we're moving on to the exercise portion of this program. For this first movement, make sure that the towel is gripped firmly behind the thigh so that you have absolute control over the movement as it bends and flexes towards the body and away from it. For the second exercise, make sure that you're squeezing your thigh muscles and pressing the knee down into the towel and relax. You really want to make sure that the movement is coming from the thigh and not your entire leg. For this next exercise, we are repeating the same movement, except first you are going to slightly move your leg to the outside, abducted, and then press the knee down into the towel, once again only using the thigh muscle. For this next exercise, we are repeating a similar movement using our thigh muscle to push our knee down, except this time we have the towel underneath our ankle to allow for some more range of motion. Make sure that you're holding the movement for at least 5 seconds before returning back to a relaxed position. For this next exercise, we have placed the towel back underneath our knee. We are repeating the same motion where we squeeze our thigh muscle to press the knee down into the towel and then slightly lift the heel off the ground. For this one, you really want to make sure that the movement once again is coming from the thigh and not the entire leg. Now we have moved to a seated position. Please make sure that you are positioned close towards the edge of the chair, sitting up nice and tall as you push the hips back to lean forward with a straight back. Make sure that the operated leg that we are working on is as straight as possible and toes pointed up towards the ceiling to ensure maximum stretch during this position. It's important not to hunch forward. For this next exercise, we are gently dragging our heel and sliding our foot back towards the chair and gently relax it back forward. You really want to take your time for this movement and get the maximum amount of flexion in that knee as possible. For this next exercise, we are using a similar movement. This time we are using our non-operated leg, crossing our ankle over our operated leg, and similarly dragging the foot backwards to create flexion within the knee joint. Now in a standing position, holding the back of a chair, slide your leg outwards as much as possible and back in. Make sure not to tilt the torso. For the next movement, we are repeating a similar motion except sliding our foot backwards and while maintaining that upright torso position. For the last movement of this exercise program, we're doing a sit to stand position. You're going to gently lean forward, push through the heels of the foot to stand up tall, and using the handles of the chair to help lift you up. If you don't need the handles, please make sure you have confirmed with your therapist that you are ready for this movement. After you've completed 10 repetitions of each exercise, make sure to go through this routine one more time and talk to your therapist if any new problem develops.